This is Dr. James, and I was tagged in a video about how much alcohol a breastfeeding mom could drink safely. And some of the stuff that was in the video was correct, I feel, and some of it was just garbage. And let me try to explain what it was I saw. This was a lactation consultant, and she was saying that our current recommendations for alcohol consumption and breastfeeding were outdated and wrong, and that she felt that it was fine for moms to drink and not have to worry about it. And then she used some examples that were just way off. Her example that she used was that she used the legal intoxication rate in Great Britain, and that was the concentration that you were legally intoxicated with in your bloodstream. Now that concentration is the exact concentration that will be in a baby's breast milk, and that's going to the baby. Now it is true that will dilute as the baby goes through the baby's liver, and it won't be the same. Just like it takes more alcohol than what you get in your bloodstream, and so you'll process that. The problem is that she didn't calculate in the fact that the baby's much smaller, and just like it takes a lot more alcohol to get me legally intoxicated than a 100-pound woman, it's going to take a lot less alcohol to get a baby impaired than it would be a full-grown woman. And it's much smaller. Take a 10-pound baby, a 100-pound woman, you would have to take what it would take for a 1,000-pound man. The math is all wrong. And then she used that there was alcohol naturally occurring in orange juice, and that the alcohol that you would drink would be the same as giving a baby orange juice, which does not compute at all. She was using terrible examples. Everyone that recommends anything as far as alcohol says there is no safe level of alcohol. Now, what we do know is that for one drink, it will show up in your breast milk for the next 2.5 hours. So if for one drink, if you waited 2.5 hours, the results and problem, or the amount of alcohol that the baby would get, would be very small, and the effects would be negligible. Every other drink you have adds another 2.5 hours to that, and increases the amount of alcohol that a baby's going to get. When we look at the effects of fetal alcohol syndrome, of what alcohol given to mom while pregnant that then goes to the baby, so it's metabolized by mom's liver and is metabolized by baby's liver, but then has the effects that it does on fetal alcohol syndrome, and we are unsure exactly what that level is. We know that the baby's brain is developing for the first 2 years at a very rapid rate. And so any effect on that could be big. And so we try to avoid that. So there's also some studies that have shown that, one glass of wine might increase breast milk supply, but when you get to 2 glasses of wine, that doesn't help. That actually decreases breast milk supply. And so, I think that probably in moderation, and by moderation, I'm meaning one that is timed so that you have the maximum amount of time before you're breastfeeding again, I think the chances of it doing anything to your baby is really small. So I think a celebratory glass of wine is not going to hurt anything. On the other side, when you drink more than that, not only do you have the risk of what it's going to give your baby through breast milk, but you also have the fact that you could be impaired and not able to take care of your baby well, that you could fall asleep in unsafe sleeping positions, and all those things as well. So still, my official recommendation is, if you try to avoid alcohol as much as possible, because there's really no safe level. If you are going to drink, do it very minimally. If you are going to drink to excess, I would not recommend giving that baby that breast milk. I would use it for another pump. I would do the pump and dump, or pump and use it for a bath, or whatever you want to use it for. But I don't think that we can safely say that that is safe for the baby. And I know of none of the official organizations that try to protect babies that sanction the behavior that she was coming out and saying that this was the new okay. And so if you want to protect your baby, I would not do that.